Hey, this is Doc B coming at you from Turquoise Trail Therapeutics in Santa Fe, New Mexico. So we want to further our discussion about how we like to assess uh, dysfunction or asymmetries of the thoracic spine, and in two particular planes of movement. We want to look at extension and we want to look at rotation. That's where most people are deficient or inhibited. And so we're going to look at three ways we assess that here in the clinic. Linnea is going to help me demonstrate thoracic rotation. So we ask the patient to get into a child's pose-like position. Buttocks are rocked back on the heels, and what this does is it locks out our lumbar spine so that when we truly rotate, the motion is coming from the thoracic spine, not the lumbar region. So the bottom forearm or the post forearm is going to be in between the two knees. In this case, the right hand will be behind the head, and I'll ask Linnea to rotate her elbow up towards the sky as high as she can go comfortably, and then come back down, and then switch arms, plant the opposite forearm, and now we'll look at rotation to the left. And what's really great about this assessment is that we can compare one side to the other. We can see where the deficiencies or the asymmetries are. In an ideal world, we're looking for 50 degrees of rotation here. Now, for our next assessment, we're going to actively assess thoracic extension. So we'll ask the patient to go completely prone on the mat, or in this case, on the table. The pelvis ideally will stay on the table. We'll ask the patient to put the hands underneath the shoulders and do a prone press up. The goal here is to keep the pelvis on the ground. We're looking for full extension of the elbows, but some people may not get there. Linnea doesn't get there. If she were, her pelvis would come up. We're looking at how does the thoracic spine extend. You can relax there. We're looking at how do those vertebrae extend on one another. In an ideal world, those arms are straight, the pelvis is on the ground. Now, I'm going to have Linnea sit up. This is going to be a passive extension for the patient. It's a great way for me to manually assess. I can get my hands on the spine and really palpate and feel where the lack of motion is. So I will ask the patient to interlace their fingers behind their neck. I will ask them to rest their elbows on my forearm, and then I'm going to glide them forward while I use my right hand in this case to really assess these segments. I'll start down low, I'll glide them forward, and I'll feel, okay, are those spinal segments extending under my palm pressure? When they're locked up, believe me, you will feel it, and it's a great assessment tool to assess for thoracic extension or lack thereof. So these are the types of assessments we do here in the clinic. They're very informative and diagnostic, and they really help us nail down which segments of the spine need the most attention. Stay tuned, because in future videos, we're going to talk about how we treat this condition. And then even better yet, we're going to teach you ways to stretch and strengthen this region to help decrease your pain and improve function. Thanks for watching.